And now, may I invite Dr. Vytenis Andriukaitis, Minister of Health of the Republic of Lithuania, and Dr. Joseph Figueiras, Director of the European Observatory on Health Systems and Policies, to take over the co-chairmanship for the first session of our conference. Thank you.
Honorable Prime Minister, Honorable Zuzana Jakab, ladies and gentlemen, dear colleagues, dear participants of the forum, dear friends. Of course, sustainability and efficiency of health systems is one of the key priorities of the Lithuanian presidency in the area of health policy. Lithuania started the main discussions on this issue during the informal Council of Ministers held in July in Vilnius. Later on, the discussion was continued in the annual conference of the European Public Health Alliance, held in September in Brussels. This subject was also relevant at 16th European Health Forum Gastein, and the Conference of Health Systems organized by WHO in October in Tallinn. Finally, the significance and aspects of sustainable health systems are planned to be repeatedly reviewed in this Health Forum conference, and productive discussions held are to be summarized there. At the time of its presidency, Lithuania will encourage to complete the process of consideration on modern, open and sustainable health systems started in 2010. Currently, there is a prepared project of the Council's conclusions on modern, open and sustainable health systems discussed in the Council Working Group, which is expected to be approved in the formal Council of Ministers on the 10th of December. These conclusions will emphasize the necessity to strengthen the capacity of the European Union member states to apply the health in all policies principle in practice and to encourage sharing of the best practices. The conclusions are planned to include the implementation of the Europe 2020 strategy objectives in the health area, effective investments in the health sector, and the use of the EU structural support, innovation in the pharmacy field, integrated care models, and better hospital management, and of course, efficient and responsive financing. During its presidency, Lithuania plans to seek for a consensus with the European Parliament on the review of a very important tobacco products directive. We all know which is pressure from tobacco industry in this field. The proposal seeks to reduce differences between the legislation of member states, coordinated labeling tobacco products with warning measures, improve consumers' awareness of the contents of tobacco products, harmonize laws in the restriction on the use of substances hazardous to health and increased appeal of tobacco products, and to regulate the availability of tobacco products in the market. The main goal is to ensure that young people do not start smoking and that others give up smoking or smokes less, and to protect the society from this especially harmful health-damaging action. Lithuania also seeks to reach an agreement with the European Parliament on the regulation of clinical trials of medical products for human use. The initiative aims to simplify the procedure for the submission of applications for clinical trials and the issues of permits from them to be harmonized at the EU level, flexible and efficient. Also to supplement them with rules on the performance of clinical trials in emergency situations, to revise and simplify the principles for compensating persons undergoing trials for damage incurred during the clinical trials, update and modernize security reporting procedure, define more clearly the responsibility of a persons ordering clinical trials. This is a very important aspect of the promotion of scientific research and innovation as as well as the development of pharmaceutical industry striving for a better competitiveness of the EU on a global scale, and for more clinical trials to be performed in Europe, as well as for better accessibility of medicines to the European Union citizens. Lithuania will seek for progress in negotiations on 2 legislative proposals in the field of medical devices, on regulations on medical devices and in vitro diagnostic medical devices. These proposals are aimed at the elimination of shortcomings and gaps of currently valid legal acts, strengthening the supervision of the declared bodies of medical devices and clinical evaluation rules, also tightening the provisions on market supervision and vigilance, increasing the traceability of medical devices and improving system management, determining ways of effective institutional cooperation. These initiatives are expected to encourage innovations in the area of medical devices, ensure smoother functioning of the internal market, and a high level of human health and safety. On 25th October 2013, the European Union Directive on the implementation of rights to cross-border health care services aims at ensuring freer movement of patients across the EU countries for them to be able to easier receive the desirable quality and safe services came into force. Clearly, this innovation will allow medicine and medical professionals to become even more valued abroad for high-level services, their quality and innovation applied in medicine. Discussions are necessary on relevant issues, on possibilities to cooperate more actively in the implementation of this directive, opportunities of border regions, also for developing reference centers. Of course, we see new challenges in this situation, especially when we speak about budgetary problems. In order to ensure that citizens of Lithuania are healthier and live longer, health of residents of Lithuania improves and health inequalities are reduced, a draft Lithuanian health program providing for the goals and tasks of wellness activities as well as achievable health level indicators has been drawn up. The main goals of the Lithuanian health is to reduce the consumption and accessibility of alcohol, tobacco, narcotic, psychotropic substances, enhance the prevention and control of chronic non-infectious diseases, reduce socio-economic differentiation of population, and other important goals. Health sector is very receptive to science and innovations. A lot of them are introduced in this sector as compared to other sectors. New modern technologies can change methods of healthcare provision and organization. However, the potential of new technologies and their impact on productivity and efficiency should be assessed very carefully. Given the demographic trends of the future and the need to apply innovation for the assurance of high quality and accessible healthcare services to citizens, it is very important to continue investing in health and to effectively use the European Union structural funds allocated for this purpose. At the same time, we have to more intensively measure the results of investments in health. The condition of health of citizens strongly affects their participation in the labor market. The progress on the health sector leads to increased healthy life expectancy, which allows extending the retirement age, reducing social benefits. Thus, healthy residents contribute to creating value added in the country. One of the future prospects of health systems is an integrated healthcare model, which is especially relevant upon increasing threat of chronic diseases, the control and prevention thereof. Patient involvement is also a challenge. A question of how to enable patients to better take care of their health conditions in order to remain longer in the labor market and fully participate in social life remains important. Discussions on chronic non-infectious diseases are currently coming to an end, and the European Commission has prepared a report which is being considered in the Council high-level working group. This work will be useful for further debates on this very important and relevant issue of chronic diseases. The big summit will be organized in 2014 on this issue. A number of good practice examples can be found in the Lithuanian health sector. For example, according to statistical data, infant mortality rate has decreased in Lithuania by almost 3 times over the past 15 years. Cardiology program of the eastern and southeastern Lithuania, the concept of the reduction of the morbidity and mortality of residents from cardiovascular diseases, integrated interinstitutional project is being implemented. The project is significantly contributing to increase the social capital and development of social infrastructure, improving the provision of health care services. Project implementation leads to increased quality of the provided health care services and the variety thereof, also improved complexity of service provision. Finally, it would be very important to have more active intersectorial collaboration at European level in solving public health issues. We need better cooperation and at the high political level involving all sectors, because today's health problems could be solved only using different policy instruments and implementing health in all policy principles at EU level. We need also consider other ways to strengthen EU health policy making, including possible modifications of existing legal framework at EU level. On the other hand, the recent socio-economic development of OECD countries has established the health sector as one of the growing sectors in the modern economy, bypassing agriculture, transport, and making it closer to most important sectors in the terms of value added, scope of research and development, etc. This development creates a backward to consider responsibility of health sector for major socio-economic parameters of the modern society. Health is a major contributor to the growth and employment and should be taken into account planning public finances, social insurance systems, seeking to promote research and innovation, reduce poverty, boost competitiveness of leading world economies. I would like to say that all those questions are very important. And I wish all of us good discussions, why I invite Joseph Figueiros to moderate our panel discussions, panel debates. Thank you very much indeed.
Thank you very much, Mr. Andriukaitis.